Good health is crucial to our quality of life, empowering us all to live our lives and support our loved ones and our communities. From treating and reducing illnesses, diseases, and other health impacts to strengthening our bodies and minds, health and well-being can create a thrivable future where everyone can live happier lives. That's why we've invited 3 experts on these fields to explore how we can use information and data to create healthier people and communities. They are Mr. Abdul Khurshid Bhatti, the CEO of Association for Human Development Pakistan, Mr. John Ogundiran, a research fellow at the University of Coimbra in Portugal, and Dr. Shalvaree Vaidya, a health economist and life sciences professional and advisor on market access strategies, healthcare sustainability, and patient-centered solutions. After their presentations, they kindly took questions from the audience.
That was a very insightful session. And before we start with the Q&A session today, I'd like to thank our guests for sharing their valuable knowledge and experience with us. And as I always say, with step by step and drop by drop, we'll certainly make a big change for a thrivable future. With that, we move on to the first question, which is open to our 3 speakers, and anyone can answer first. So my first general question to all speakers is, what are the biggest challenge to achieving good health and well-being in today's world? Can these challenges be addressed primarily through change in habits, or is any technological assistance is necessary?
I think one of the biggest challenges I see is just the misinformation about health and well-being that exists. The same tool that can really help us, which is these digital technologies and social media, is also something that is incredible at spreading false stories and narratives and facts, and even the way in which research papers and studies are taken out of context and used as a clickbaity, way of spreading information by news outlets as well. And the kind of conclusions that are reached are really incredible to see, because that leads to really pervasive misinformation that lasts for generations, right? So, and we've seen this in the past with things like autism connected to vaccines and other such kind of things, where once it gets into the psyche of the population, it really takes off and it's hard to bring it back in. So of course, there are some challenges with actual diseases and the burden of illness that is increasing, but I think overall, we're in a new era that has never been seen before, and that's something to really keep in mind.
Thank you for that perspective, Dr. Vaida, because that touched on human behavior. Human behavior for me is both a function of both the victim and those perpetrating it. Like the people who are posting and driving this content and those people who are being fed. But this also brings to mind the awareness or the necessity for science to bridge the gap, because it means that the days are gone that we would have scientific studies that would just stay in the journals. An average person doesn't go to a journal to find articles. Before I became a researcher, I was more an engineer on site and doing all of those things. And I only did research things that were needed for my work, but we have to find a way to communicate science. And that's why I also appreciate the practicality of Mr. Abdul's initiative towards the water interventions and stuff like that. But this is also a good webinar. I really commend the webinar organizers, because we need to be able to bridge the communication gap. And just to now give a final answer to the question regarding how to tackle the issue of health and well-being, it's a concerted effort. It's human behavior in combination with the advantages of technology, both for energy, which is more like the issue that is being talked about every time, to have energy efficiency and all of that, But it has to do with both human behavior as well as good technology. So while infrastructures have to be put in place, humans have to ensure that the right policies are in place to ensure the participation of the public and also stakeholders. Human behavior, it behoves on human behavior to turn off the light switch when they don't need it, You understand? To wash their hands if they need to wash their hands, to wear a mask if they know that they've been reported infected. So it's a concerted effort. We cannot say it's just one approach. Human behavior plays a critical and significant role in all of the in what we're talking about. But we can't do without innovation, technology, and infrastructure. Thank you.
And I have been working on this since past 28 years. So what we have, we do work on the wish and want. We don't work on the need. So what I saw when we go to the education, we go to the universities, we go to the higher appliances, higher life standards, and that creates the all material and wastage and lost. But when you go to the natural, you clean all. I give you the example. In 2003, my son born, and he mother now studying in a BBA, and he done excellent education, but he never sick. He's a genuine, and he drink and eat originally. And I saw, oh, his friends, his many friends sick and underweight and a lot of issues because they're doing jobs morning and evening and time unrest and lot of so huge problems. When we go to the larger life, luxurious life, then problems not for us, but the rich people suffer through means I easily say the rich people damage the poor. But if we go to the natural, you see, our Nadi filter cut off the plastic. If you give one family, he can filter water. He forgot the bottle. This is a huge life if we go back to the nature. If we go back to the nature, I'm happy. I was travel in the Nepal. I saw very few vehicles there. People traveling, people in mountain walking like on a straight way. No problem, no anything, no health issue. But we people on a straight road and luxurious houses, if we travel 1 kilometer, we will die. So I say to go to the natural. Still, there is a what I do, poverty ending, climate, all natural. And if you give the people natural, oh my God, all things cut off, disease cut off, problems cut off, and other things cut off. So I say, natural we should adopt.
Thank you all for sharing those thoughts. And I do agree that I think the basic thing we can do is to change our habits. And then obviously we can look forward to the technological assistance to help us get better. Now I'll come to Mr. Bhatti. My question to you is, what challenges did your organization face when you introduced Nadi filter for the first time in the communities, rural communities in Pakistan or any other country that you have worked?
With the grace of God, I didn't got any challenge. Never people stopped me. But what I seen the some water companies and some government officials, they oppose me because in one city, I give you example, three districts in Pakistan was very poor in data of 2010. Now, when in 2023, when data, the districts are rich, the district government and others, some oppose me because they didn't receive the funds. So this is way, if the people get the safe drinking water, they cure some 36 diseases. Where gone these medicines? But when visit the rural families, landlords, and sit with them. And maybe I think we don't need the funding. We go to the people, we sit with people, ask them, this is your problem, do contribute, and that's all. But the problem is with me. I am from Hyderabad, Sindh, remote area. I do not have such social media, and I'm so happy Thrive who framework who taken me to this, and these webinars go on large scale, and that is amazing. And I hope where we will go, no issue. Everyone will support us because we are not damaging anyone. We are helping the nature. So I didn't face, even I faced, so I forgot. So if I face problems any second day when I visit the rural families, people drinking safe water, people have solutions, they appreciate me, I forgot all. So what I learned to reach people, to reach new people. If someone oppose, no worry, we can go second one.
Thank you, Mr. Bhatti. And yes, we are happy to have you on our event, on our webinar, and more than happy to help you further your voice to help people in rural areas of Pakistan, in your country, and other countries as well. So now I'll ask my next question to John. In one of your slides, you highlighted the lack of awareness and the data on IEQ in tropical Africa. And that has been one of the key motivations behind your study that you've done. Given these challenges, how can communities be educated about improving the IEQ, especially with limited resources?
To just emphasize, one of the motivations of this research has been basically absence of awareness, absence of scientific data, because, well, there should be general awareness, but because education or academia is an authority of some sort of credibility when it comes to information because of the procedures of science and all of that, it's important for there to be studies. Now, however, studying and giving all this research, as we were discussing earlier, does not mean that the information has gotten to the people. And so the first thing is that the regulatory bodies and because every country has leadership, every country has government, every country has infrastructure that is at both transportation level, hospital level, school buildings, and religious buildings and residential buildings in terms of real estate. Once the government has this level of awareness and can trust the research or information from the public, from the academic world or the educational institutions, then they can implement some sort of regulation or create frameworks for these kinds of things to be present at these levels of institution. Now, it behoves on the sub managers and stakeholders and leaders to communicate to the people who are directly impacted. For instance, one practical way of communicating this in terms of the young children will be to introduce curriculum in the schools about well-being and health and the necessity to keep indoor environment adequate. Again, if policy was made to curtail the use of the irrational use of music and noise, as you know, in many developing tropical countries, in traffic hotspots, in transportation areas, you have them selling on the streets, socioeconomic activities, parties, and I know these things may sound strange in the civilized world, but these things occur. In transportation vehicles, you have people commercializing and trying to sell products at very high level of noise and using speakers. This is something that is a concerted effort. We have to make policies that allow for the local regulators or local leaders to communicate the conduct or the best behavior of human beings in the context of indoor environments, whether in vehicles or buildings. That's one way. At school levels, in secondary schools and primary schools, these awareness can be created by introducing it in the curriculum. In the villages where they don't have access to good education, or they cannot read or write, science can be implemented in communities, and people and the people who know, uh, like from the schools. For instance, I give a real life example, and I'll stop talking. In Nigeria, we have what we call the National Youth Service Scheme. When you finish from the university, you should go and participate in this scheme. And this scheme allows for you to be you can be sent, for instance, if you studied in the West, you may be sent to the North and all of that. It also encourages intercultural exchange. But because you are closer to the communities, you are like a graduate, you understand these issues. And so this becomes an opportunity to create small NGOs, local social gatherings, to communicate with the people, the right information, prepare materials that can sensitize the public on the demerits of public health risk as a whole. And because IEQ is just one of the factors, it's not the only factor. If outdoor pollution is curbed, indoor pollution will be mitigated to an extent. So what I'm saying is that it's not one solution or one size fits all, but it's a concerted effort both at policy level, mid level of leadership intervention, and also the grassroots level. Also, this means that in communities, leaders should not just be elected without the consciousness that they need to have information about basic things of life like healthcare and welfare. Sorry, I can go on and on talking about this, but these are a few ideas, in my opinion, to help the situation.
And I do agree to many of your points that you mentioned, and they are very valid. I'll come to Dr. Shalvaree. So my question is, in your first slide, you mentioned social stigma as a significant challenge. In your view, how one can engage with communities to help change their attitudes? So could you share any examples? That would be great.
Yeah, sure. So overall, I think, stigma occurs with a lack of understanding, a lot of misinformation about certain medical diseases and illnesses. Especially, I think this is a very big thing in rare diseases, because already there are so few people that suffer from these illnesses. So a lot of people won't come in contact with someone who may have a rare disease. It's not something that occurs to them, or is something that they really interact with. And this kind of stigma can really lead to the patient feeling very isolated, and their caregivers and their families too. It can also lead to a lot of discrimination from the community. So yeah, it's very important to kind of look into this type of stigma that exists. I think what's really important, one, is educational and awareness campaigns for the community, for children in schools, community level collaboration efforts, really having these partnerships with local leaders and NGOs, and really trying to build trust and foster that communication between patients as well as the community, because we also want those that are suffering from these illnesses to feel confident enough to speak on their on what they're going through. And now with kind of digital social media, we can really share patient stories and have this kind of empathy narrative and understand people's perspectives a lot better. There have been many very successful campaigns that have dealt with and reduced stigma for various illnesses and diseases. I think one of the biggest really success stories has been this kind of HIV/AIDS of the 90s, and that was one of the biggest, I think, campaigns that have been run to really reduce the stigma, and to not see people who have this kind of illness as some sort of having some sort of, moral failing, that it's beyond that. And so we've come a long way with that kind of thing. In the UK, there was a really really popular, very successful mental health awareness campaign. There has been, and there's still an ongoing campaign with leprosy in India and trying to reduce the stigma, and especially now in rural communities. So there is a lot of advocacy work and education awareness that's being done as we speak with a lot of illnesses around the world. So it's going in a good direction, and we need to keep at it.
Thank you, Dr. Shalvaree. Those were good thoughts. Now, I'll again come back to Mr. Bhatti. What types of training do you provide to communities to facilitate the adoption of the Nadi filter? Because you talked about the basic training that is required before you introduce the Nadi filter to people. If you can talk about that. Thank you.
First, we visit the communities and we discuss with them what their problems, and we just sort out their problems. And the biggest problem everywhere, health, basic health, and safe drinking water. So then we support this safe drinking water to the people. And when we support this Nadi filter, we ask people, we will not fix this Nadi filter through our own hand. This is our life vision. We ask people to, this is the steps, 14 step of this Nadi filter. Take this, build. We are standing here and we guide them and they build. So amazing. We trained thousands of peoples. Even if you go to the one family and you talk to the old person, you ask him, how is Nadi filter? Did you know? He will say you yes. He will give you a whole process. Then you talk to the old woman. She will give you whole process, how it made, how it clean. Then you go to the children, 10-year children, 12-year children. What happened? This Nadi filter, a peacemaker. When two villages having tussles each other, and we select one village, and we ask village, you go to the village, second one, they're fighting with you, ask them, this is a peace promotion, and give them this Nadi filter training, and they will be happy. So we make many these problems to solving. So this is a training we definitely, whenever other countries we are giving, rural people. The people, rich people we get money. But rural people are target. The people, vulnerable, indigenous, all are talking. So these are our target, and we trained these people. But we do not train the rich people because they will copy paste. But the people living 150 kilometers far, we give them training. And once we give them training, never they call me, my organization, never they need again training. So this is as easy, self-explanatory, and we help. And if we supported 365,000 people, we trained 1 million people. So this is a way this Nadi filter, this Nadi filter may be sometime broken. They need new pitcher, new pot. So in our cities, I will share you the picture. If you go to the bazaar, the Nadian pot is on the shops. People purchase, people go their houses and they made. We never asked, sir, our filter is not working. No. If someone asks to call our office, my team go there and ask, give me us money and return this Nadi filter. Why you not get training? So we making skillful people. this is a multi-benefits. I can't tell all the benefits.
Thank you for sharing that. While you were talking through the process of training, how you help people learn about it, I was just thinking that it goes with the with perfectly with that saying that help a person learn how to fish so that they can feed themselves for lifelong. So it's exactly the same.
I share you when we travel in rural Sindh, because we given a large scale. In my car, I didn't take the safe water. So we stop any village, we ask them we need water. So yeah, they know, oh, they will need the Nadi filter water. So we get. And what I saw in my life in past 15 years, the farmers plowing in the land, plowing, and the bottle on the arms. And we ask, what is this bottle you are taking? So they're saying this is a safe drinking water of Nadi filter. So it is taste very good. So canal and fresh water is muddy water. It tastes not good. So that is why we now carrying this. So this is an amazing solution. Every day I learning from this, from the communities, and people have a separate this and cooking stove also. I teach cooking stove in South Punjab some 10 year back. And in winter season, when we go in the village and they uh, invite us for the lunch. So for the lunch, they asking to wash hand. So when I wash the hand, so I saw the hot water. So I say, how it becomes hot water? There's a cooking stove is running, and they put the tin tank upper of the 8 feet high on the roof, and when the stove is burning, the hot is going and the water is hot. So many solutions are there and uh, enjoyable.
Oh, thank you. Thank you for sharing your experience with all of us here. I'll come to John. There is a question from Mohammed Munir, one of our viewers, and he thanks you for the presentation that you made. He would like to ask that considering the context of Africa that faces unique challenges due to rapid urbanization, its diverse and often harsh climate conditions like high temperatures, dust, humidity. How well we can ensure thriving IEG or air quality standards in this context where there are so many challenges.
Thank you for the question. The truth is that it's if you want to eat an elephant, they say you should start with little chunks of bite. Okay. The problem is an elephant-sized problem. The problems are also interconnected. It's not just IEQ. The problem is that Africa as a whole, especially sub-Saharan Africa, we are not adequately sincere about the implications of climate change and all of that. But there's a major challenge, even if you wanted to respond to this with technology, is that there's an energy deficit. There is not enough supply of basic energy. And the issue is not resources. So the first strategy towards ensuring sustainable solutions in Africa is, or in developing tropics, not only Africa. I know this because of some of the reviews that we've read and the ones we've done, is that we must start at the political and regulatory level. We must create institutions and infrastructures. I mean, when I mean infrastructure, I'm not talking about physical infrastructure. I'm talking about administrative infrastructure that is aware of the issues and is willing to respond or effect or implement solutions. And we will start through policies, because you cannot make everybody do right. You can only create laws, just like everybody has to go through some lessons to have a driver's license and then drive on the road. But everybody will not just get on the road. We have to teach people these things. We have to demand it through policy. We have to demand it through laws, but without necessarily and also this is why we have to think about adapting it to the local context. topics, because for a long time we've imported technologies and solutions, but we don't have the same solution framework in these regions. We've imported solutions from the Americas and the European countries, and we thank them and we thank the institutions for taking the lead in these global challenges. But given the context that there are cultural differences, there are peculiarities to this region, we have to start with the right leadership, the right policies, the right regulatory framework. Now, when we've gone to that level, we have to also sustain the awareness through educational institutions from primary to nursery levels. For instance, there's a stark absence of this curriculum in many of our of our education system or academic systems. We don't there are no topics dedicated to IEQ, for instance. And people also still perceive IEQ as only air quality. But even I can remember the figures well. Even in the EU, there's quite a significant budget of over, I think, 43 million euros or more. I mean, I stand to be corrected, but it's quite significant to noise-related illnesses yearly. And we're talking about consistent exposure to ambient noise or indoor noise that is out of range. You understand me? So the issue is not just air quality. The issue is not just temperatures, and there are rising temperatures due to global climate change, besides the fact that in the tropics, we already have humidity variations and temperature variations. So the issues are quite a lot, but it's an elephant issue, size issue. We need to bite it in bits. First, we start with awareness campaigns. We start with even family level awareness, where people who are schooled and educated and have engaged these kinds of information should try to implement energy awareness, energy management awareness, hygiene awareness. We shouldn't just leave it to the books as we have done so far. And as this begins to thrive at such small units of the society, it trickles, it expands and grows into the larger scale. So for sure, we can have personal engagements on these discussions if you want, because of time. But this is my perspective to solving the problem in the developing tropical context. We start with awareness at all levels, academic and even in the community and social level. Of course, with policy and political.
Thank you, John. Thank you very much. My next question is for Shalvaree. So under adaptive reimbursement, you mentioned the subscription model, the next Netflix model, where government pays a fixed fee, and we understand that the medicines or the treatments are very expensive. How feasible it is for the governments of developing countries to adopt to such models, especially when their healthcare systems are already struggling so much? So what are your thoughts?
Yeah, this is something that's, I think, a very important consideration. As a whole, adaptive reimbursement strategies, the whole goal of them is to make it more feasible, more affordable for everyone involved. The way the traditional systems and reimbursement policies are right now for rare diseases, it's really we're going down a path of bankrupting our healthcare systems. And that applies to Western and first world countries as well. So of course, for low income and middle income countries, this is also a huge consideration, and how they can give access to these medications for their patient populations. The thing with adaptive reimbursement is there are some positives there that are really beneficial when it comes to affordability. So one being something like cost predictability, right? So we don't want just a exorbitant one-time fee right off the bat, and that's no matter which country we're talking about, that can be very a really challenging thing to deal with. So something like a subscription model that then what the cost is. It's fixed, it's predictable, it makes it easier to budget, and it makes it easier to really spread out the cost over a longer period of time. And then that can also improve access. So the point with these kind of reimbursement systems is like it has to be structured well. And if it's structured well and it's innovative, it can really increase patient access, especially for medications that would otherwise be really unaffordable. And the big thing with adaptive reimbursement is also the risk sharing aspect. So we're really trying to get the various stakeholders to share the risk, and it's not just on the healthcare system or just on the government. If the pharma companies also come to the table and share some of this financial risk, it really reduces the pressure for all those in charge. And so, yes, it is for kind of least developed countries, it's very challenging as a whole. There's limited healthcare budgets, there's infrastructural issues and constraints, and government priorities that are not, there's competing health priorities. And also from the pharma perspective, they could be a bit hesitant to really offer discounted rates in kind of lower income markets because they're not sure about the financial sustainability. But I do think that coming up with innovative solutions like, tiered or really hybrid innovative pricing models, international partnerships with global healthcare organizations, implementing in a phased way, and kind of public-private partnerships, those kind of things. So I think, and also the big thing is negotiating power. That's kind of huge. So really volume requirements for a pharma company are big, right? So it's maybe not just up to one particular low-income country. If multiple countries come together and use their negotiating power to come up with maybe one access to a specific treatment based on this kind of partnership between all the countries, then that's a potential thing that could be very helpful as well. So yeah, so overall, I think it can be more challenging for sure, but also I think adaptive reimbursement at its core gives the option. It gives something flexible. It gives something other than what we've been traditionally doing that hasn't been working and that will not work in the future. So even for low-income countries, it gives them an opportunity to do something and get access still and have access to these kind of flexible payment plans.
Yeah, I do understand that. Yes. I'll quickly ask a question from one of our viewers. Her name is Aisha Aziz. She's joining us from Pakistan, and anyone can answer this one. I mean, there's no specific person to answer this, but her question is: what initiatives are being implemented to improve water health in interior Sindh, and how effective have they been? So I think Mr. Bhatti will be the right person to talk about this. But another question she adds on is, are there any community-led total sanitation programs or other behavioral change interventions in such regions?
Thank you, Asha. I have been read your messages and water and sanitation. Yes, water and sanitation is a big issue in Sindh. But what happened in districts we are working, we sensitize people and we ask people if we are giving you the Nadi filter free. This is in Pakistan, 10,000, 12,000 activity. We giving you a free, you will build a latrine at your house. You will build a cooking stove, smoke free. And this is a way the climate change in Thatta and Badin is better now. So this is our priority. Means if we working in a village, first we organize a CBO, village-based CBO. Then they prepare a smoke-free cooking. Then we give them the Nadi filter free, and then ask them to install their low-cost latrine. And low-cost latrine, sometimes we give them the WC and they prepare on. Because if in rural you build the latrine models, it will not work. The landlord or some teachers or they own this washroom and lock it and use for them. So this is a way we ask every villager to make their own. And now in many thousand villages, there is a very healthy environment. But what NGOs are doing, oh my God, 50,000 rupees, low cost latrine, 50,000 rupees. One hand pump, 150,000 rupees. And now all hand pumps are brackish. I fight some INGO last day, and they, water related INGO, they shared they installed 3,815 hand pumps. So then I was very upset. I say, oh, these all hand pumps become brackish. Same in Africa. Borehole and hand pumps make in dry Africa, and same in the Sindh and Pakistan. People don't understand that fresh water is going available. Maybe conserve it, save it, make it clean. And same the sanitation in the tribals, you can't do. But if you mobilize the women and they ask their men, male and female, and they made their own washrooms, that will work. So this is a way, maybe Aisha, you can visit our villages where Thatta, Badin, where we are working, and you will enjoy this sanitation and all. This is like 1 in 3. If we give the Nadi filter, then they do the sanitation and smoke-free cooking.
Let me speak from my perspective, and maybe Dr. Vaidya can address costing issues and all of those, as even she has brought to us this awareness about this kind of possibility of adaptive stuff. Water is the first thing I believe is that water is ensuring sanitary water is a global responsibility. And so for the impact to trickle down to a place like Pakistan, Nigeria, India, water is consumed globally. And so generally our attitude to water, to available clean water, has to also change, because there are two dimensions to it: ensuring sanitary water, and also the efficient use of the available water. So the first thing is that more effort has to be made to ensure that there's potable water, but there also has to be effort to implement initiatives for reuse of what we call gray water. You understand me? Because the problem is that there's so much effort in trying to ensure that water is available in buildings and to people, but we haven't looked at it from the perspective or we have not sufficiently addressed the perspective of optimizing what we have available. And so, even for a place like India, yes, they do a lot of washing, they do a lot of that. And so, one way to first of all begin to bite the big elephant again of this problem is to ensure that in the value chain of ensuring that water is available in a sustainable way, water that is being used, for instance, for washing and other things, and maybe I encourage my panelists, Mr. Abul, to also look at this part, is to perhaps invent another sustainable technology to ensure that gray water is reusable for other activity. And when I mean gray water, for instance, water that you use to wash your plates, your spoons, they may not be as infectious as water you use for the waste system, for the WC or something. And even in some context, the WC water could be. But I mean, let's start with basic things like washing of clothes and plates and other things that we use water for. If there are means to collect these in reservoirs and employ some sustainable strategy to recycle them for use, then it will be easier to channel resources for us to make more sustainable drinking potable water for drinking, which goes into us. Because what is competing with the availability of water now is not just the one for drinking. In fact, if you probably look at the statistics, you will see that more water is consumed externally than internally. And so, what I want to leave here as my own piece of advice is that for developing tropics, we have to also find strategies to, curtail the use of water and ensure that we can reuse water so that we can have less effort or energy consumed at providing potable drinking water in those places. I don't know if that helps in any way.
John, I just give you an example. I was in 1998 in Bangladesh. Now see, Bangladesh was poor. But what happened? The government of Bangladesh asked NGOs to do the sustainable solution or activities that benefit the people in the best health, and asking the NGOs do these activities. And amazing, in 2012, 98 and 2012, I was Asia Pacific Water Conference in Chiang Mai, Thailand. And the Prime Minister of Bangladesh was there. And there was a Bangladesh tiger in Asia because everyone has a sanitation and safe drinking water. Either they don't have a Nadi filter, they don't have clean, but still there is a solutions. And if government is, this solution can't be solved. John doing, Shalvaree doing, Karan doing their own solutions. What happened? In Africa, I am witness. Everyone has his her own solution. Big drills, big boreholes. Same in Pakistan. The big landlords own the thousand of cubic water, and tailenders have 0 cubic water. We are uncontrolled people. But now, if for Nadi Filter or Thrive Project, Blue Community, many connected now. And you will see when we unite, the problem 50% end and the rest soon end. So I learned too much from the, Gramin Yunus Habib, now is the Prime Minister, because they done great. People respect them. So whatever we are, no worry. But I think the government should take lead and ask INGOs, uncontrolled INGOs. They use 70% waste money and 30% community. Everyone happy with them. If someone asks them, government asks them to do these activities, please, you see the crisis will end. But John, if you do your innovation, I do my, and Shalvaree do his own, then no solution, and then crisis and problems and all.
Thank you, Mr. Bhatti, for sharing your views on that. We are running short of time, and this restricts me to ask any further questions to our esteemed speakers. But I would request our speakers to answer the remaining questions offline. And for our viewers, do sign up to our newsletter to get access to the Q&As and latest updates. Thank you very much to all of our 3 speakers.